Okay, thank you, Dr. Akilah Weber, for joining us today. I'll start with a brief introduction, and then we'll zoom into questions. And so for those who will be watching, Dr. Weber is a board certified OBGYN, grew up in Oak Park, went to local public schools, then Xavier University, and then the University of Rochester Medical School. She leads the adolescent gynecology program at UC San Diego Health and is an assistant clinical professor at UC San Diego, also the founder and director of the pediatric and adolescent gynecology division at Rady Children's Hospital. La Mesa council member since 2018, La Mesa council member, mother to 2 young boys and a daughter to the recently departed 79th Assembly member Shirley Weber, who is had left that position to be Secretary of State. Endorsed by many prominent people, including Tony Atkins and Todd Gloria. So thank you for being here, Dr. Weber.
Thank you so much for having me.
And first question, we'll just get right into it. Tell us why you're running to replace your mom in the 79th Assembly District, and what you think of as the biggest issue in a district that's really diverse and really spread out geographically.
Well, once again, thank you so much for having me. There are a few reasons why I've decided to run. First, as a local legislator, I recognize that a lot of the issues that we need to fix and to solve, we cannot do on a local level. We really need some movement from the state around issues of housing, social police reform, all of those things we've dealt with on a local level, but we do need some more policies, some strong progressive policies from the state to help the local legislators out to really make impactful change. And the second, of course, is the pandemic. Me being a physician, I've always known that the healthcare of individuals leads to the healthcare of very strong, healthy communities and ultimately healthy states. However, we also know that health is not just what happens when you go to see your doctor or you happen to go into surgery. A lot of what determines your health happens before you even hit your doctor's office, and we call those the social determinants of health. So do you even have access to quality healthcare? When you look to see who COVID is impacting disproportionately, it's your Black and Brown communities. It's your communities that are oftentimes don't have a voice. And so when you take a deeper dive into those communities, you see that those communities are also the ones that are dealing with higher rates of hypertension, diabetes, obesity, the same things that we're hearing as being risk factors for COVID. But then you look at them and you say, well, they don't have access to quality healthcare. These are the communities that oftentimes have to drive long distances to see doctors and specialists. And then you also look and you see these are also your food deserts. So when we're talking to patients about diet, exercise, weight loss, is that something that they have readily accessible in their communities, and is it also affordable to them? You look and you see these are also the communities that are dealing with the issues with academics and the academic achievement gap that we've been talking about for such a long time. And when we're talking about, education as being the great equalizer and really being a foundation to where you can go later on in life and what kind of healthy future you will have, making sure that everyone is on a strong foundation playing field is extremely important to ensuring the quality of healthcare for a particular family and a community. So when you look at all of these things, systemic racism, we talk about this in medicine, especially in the world of obstetrics right now. We talk about the fact that Black women, regardless of your socioeconomic status, are 3 to 5 times more likely to die or have an unintended consequence during pregnancy. So if it has nothing to do with your socioeconomic status, it has everything to do with systemic racism and microaggressions that Black women face regardless of their socioeconomic status. So tackling all of these issues, jobs, wages, being able to retire well with pensions, this has a direct impact on individuals' health, the health of families, and the health of communities. And so I decided that I would go to Sacramento to start tackling some of these issues and looking at it from a health equity perspective so that we can start to develop very healthy individuals, very healthy communities, and eventually a very healthy California for all.
Thank you for that answer. And just as a reminder, to keep your answers as brief as possible. Not that one was long-winded, but there is a lot of questions to get through.
I apologize.
No. Like I said, that question was a good length. Let me ask you about your mother. We've asked this of all the candidates, and you've obviously known her the longest. What part of her record do you most respect, and how will you be similar and different to and then her in Sacramento?
Well, thank you for that question. I have the utmost love, of course, and respect for my mother. She and my father instilled very important values in both my brother and I. And when I look at her as a legislator, there are a couple of things that I greatly admire. First, she is a very, very, very strong advocate for people who oftentimes don't have a voice. And that is extremely important because when we're talking about improving all of California, we have to make sure that everyone is doing well. Otherwise, none of us will do well. And so she has a record of being a very strong advocate. She's also extremely courageous. And so, it's one thing to just say what you're going to do, but when you come up against obstacles or you come up against forces that may be as strong or stronger than you, are you going to bow and crush, or are you going to stand tall, and continue in the path and the direction that you know is right? And the other thing is that she's very honest. You know where she's coming from. There's not a question of where she's really going to stand on an issue or not. And if she says she's going to do something, she's going to do it. And that's important because you need honesty, you need transparency in your leaders, and that allows for bridge building. Because as someone who is representing other people, especially, I know this on the city council, but especially in the legislative body, you have 79 other people that you have to work with in the assembly, and then hopefully get it through 40 people in the Senate. And so you have to be a bridge builder and be able to show that you can work with others. And you're not always going to agree on everything. And when you don't agree on something, that's okay. You move on and you work and you agree on something else. And so those three qualities are very key. And those are things that I have implemented also just in what I call my day job as a physician, but also on city council, because, everyone else is different. We all have different ideologies. We're not all from the same political party. And yet we understand that we must work together to get things done. My mom oftentimes looked at things from an education standpoint because that's her background. As I stated before, I look at things from, a healthcare and equity standpoint because that's my background. But at the end of the day, the vision and the purpose and the motivation is the same, which is to serve and to improve the lives of all Californians.
Thank you.
Dr. Weber, I want to switch gears just for a minute. You are a mother first and a working professional who may deal with childcare issues, and also on the city council. So let's switch gears to schools. When do you think that the schools should open safely, and how would you have done things differently?
So thank you for that question. Yes, I am a mother of two boys that are in elementary school, and it has been a very challenging year for everyone, but especially for our kids. They've been pulled not only out of school but out of everything that they're used to, their after school activities, their sports, vacations, and so it has been quite challenging. But we want to make sure that we go back in a safe manner. And I think that schools, every school and every district has to kind of look at itself and its resources and its students to determine when it should fully reopen. I don't believe there is a cookie cutter method that a one size fits all, because every district and every student and every family is different. But I do know that before school opens, it should definitely have the infrastructure in terms of the ventilation services to make sure that they are up to code to prevent the spread of COVID. They also need to make sure that they have adequate PPE for all students, and not just under the assumption that kids will be able to purchase their own and bring it on a daily basis. They need to be able to either have mass testing for everyone or make sure that the teachers have been vaccinated. So, without having all of those, especially for the larger school districts, I think it would be very challenging to safely reopen. And I think the other thing people need to take into consideration, especially since we're still in this pandemic, is that not all families may feel comfortable sending their children back. And if that's the case, that should be okay. And those schools or school districts should still provide a method to allow for distance learning. Some kids are ready to go back. Some schools have been opened safely, and that's great. But not all families feel comfortable with that yet. And we should be okay with understanding that. We should show empathy and understand that people are at different places. And for those who are not ready, still provide those families with the opportunity to have a distance learning plan.
Thank you.
Thank you.
Have you been able to, and is that something you're advocating for others?
I'm sorry, can you ask that again?
Yeah, have you been able to get the COVID-19 vaccine, and is it advocating to others?
So I believe your question is, have I gotten the vaccine, and is it something that I'm advocating for others? Yes, okay. Yes, I did. I'm a frontline worker. I actually do surgery. And so because of the fact that those are aerosolized procedures when someone is intubated, I was actually got the vaccine the first week that it was available here in San Diego County. And so I am fully vaccinated. I've gotten both of them. My second dose was at the beginning of January. It is something that I do advocate for people who feel comfortable with it. It is extremely important for us to be able to get through this pandemic if we have enough people vaccinated. And I understand the hesitancy. I'm not going to sit here and say that I wasn't concerned myself, especially getting it the first week that it was out. But the reality is that it is safe. It has gone through all of the protocols that any other vaccine has to go through in order to be approved. No, we do not know the long-term data in terms of will we need boosters in a year? Is it going to be more like the flu where you have to get something every year, or is it something kind of like a one and done? We don't have that information yet. However, at this point, there are more than enough people who have gotten the vaccine to say that it is a very safe vaccine to get, and it is something that I do recommend that people get. I don't, I completely understand the hesitancy, especially in certain ethnic groups, and I have been a part of different panel discussions up and down the state, specifically focused on, African Americans, because there is a history that we have with medicine and vaccines, and we must acknowledge that. And so, I've been on panels up and down the state and locally discussing and answering questions to try to encourage, every community to, especially our most vulnerable communities, to get the vaccine.
Dr. Weber has famously been a critic of public education in California and how it focuses on the interests of teachers as opposed to the interests of students. Would your focus be similar if you were elected?
So, we cannot deny the fact that there is a huge gap in education achievement. And there was a recent study that came out last month that showed that here in San Diego, looking over the last year, 3rd through 8th graders in certain socioeconomic groups, that Black students were about a grade level behind their white counterparts. And this is pre-COVID. Their assumption was that if it continued down that path by 2026, it would double. And that is unacceptable here in California. California is truly supposed to be the land and for all, opportunity for all. And so, yes, I focus on the children, and I focus on making sure that our teachers are treated well and that they're given what they need to be successful. But at the end of the day, we need to make sure that regardless of your socioeconomic status, regardless of your economic background or your ethnic background, I should say, regardless of your zip code, that you have been given the tools and the resources, that your school has been given the tools and the resources, that the teachers have been given the tools and the resources to make sure that every student that goes through our public schools, whether they're traditional public or public charter, They graduate with a foundation, a very strong foundation that affords them the opportunity to go on to do whatever it is that they want to do, whether it's a trade school, a 2-year, 4-year, onto graduate school, so that they can, like I said before, produce very healthy futures and healthy families in the future.
Some of your opponents think that the local control funding formula was a good thing as opposed to something that was sidelined and diverted, as your mom has said. What do you think about the local control funding formula and how it's worked out?
So I think that the theory behind the local control funding was good. It was focusing on equity and making sure that the areas that need the most get more. However, the devil, of course, is always in the details and the implementation. And the audit clearly from the state clearly showed that it was not being implemented equitably. And so that is the issue. And so the theory is great. So it's not something that I would completely scrap. However, I do believe that there needs to be oversight and accountability, and to make sure that the funds are going, that more funds are going to the areas and the communities and the students and the families that need it. And then not only just stopping there, but we also need to circle back and make sure that the programs or the things that have been implemented are actually working, to make sure that we don't need to revamp what we think that we needed to do. And so, from a scientific standpoint, this is what we do. We say this is how we're going to do it. We look at the data. If it's working, then great. If it's not, then we switch it up. And so that's what needs to happen. It was a great theory, but we just need to make sure that we are actually putting it into practice.
Thank you.
Our letter writers have expressed both support and opposition to the power that the teachers' unions wield in the states politically. And I wonder, how would you work with the unions? And do you think they do a good job for both the teachers and the students?
Well, I support the formation of unions. I was in a union when I was a resident, an OBGYN resident at Cook County Hospital. And, the purpose of the unions are to really look out for their members. And I can say as a resident, that's when we were switching over nationally from work however many 100+ hours to only 80 hours a week. And it really was the union that made sure that that our programs, our residency programs, were adhering to that as much as possible. And so that's the purpose of the union. So the teachers union is no different. They're looking out for the teachers and making sure about wages and rights. But I don't want anyone to forget that at the end of the day, the teachers are teaching our children. They are teaching our future. And like I've said before, if we don't all succeed and thrive, then California cannot succeed and thrive. And so, I can understand the concern that people have, and I have it at times as well, that the focus is not always including what's best for the student.
I asked a quick follow-up back on LCFF. You said that you would work to have more oversight and accountability. How specifically would you accomplish that?
Thank you. So, right. So, actually creating a board that oversees where the funds are going. Are they going in the correct places that actually need it based on data? And, that board is also going to be the one to make sure that there's follow-up to show, okay, listen, we said that, these students weren't doing very well in reading because in this area, they've got a class size teacher-student ratio of 1 to 35. Now we fixed that because we put more teachers in that area. We've got a class size of 1 to 20. And look, the reading scores have jumped from here to here. And so that's what I would do, essentially.
Thank you.
Mm-hmm.
What are your ideas for improving housing or transportation, and have those ideas changed at all during the pandemic?
That's a great question. So, with housing, we definitely need more housing units. I would definitely make sure that all of our cities are following their RHNA requirements. to make sure that we have all of the housing units that we're supposed to have within that specified time frame. And transportation is a huge issue. But as you were alluding to, COVID has kind of changed how people think, what people think about transportation. That maybe people don't necessarily need to go into their work every day, or sometimes not even at all, that most people can work remotely. And therefore, do we need to focus as much on, cars on the road, which is what we should be switching over from anyway, and figuring out other modes of transportation and making it more accessible. And those are the conversations that we've been having at MTS, since I am on the board of MTS as well. And so, yes, you are right. And also along with transportation and rethinking it, it's also about parking, right? Because if people aren't using their cars as much, then do we need as many parking spots for different housing units and restaurants or other buildings that are being created? Because will they be either using mass transit or other forms of transportation if we're not out and about on the road as much? And so, yes, I think COVID has really propelled that discussion. When I ran for city council in 2018, I was speaking with a resident here who runs one of the village programs, and he was saying, you know what, in about 20 years, we won't even need any of this stuff, any parking and all of this, because everything will be changed. And all of a sudden in 2020 with COVID, it kind of propelled that discussion to the forefront. So yes, that is something that, is definitely probably going to change. People are sitting back and realizing, I may not need to do this, or this may not be as important. I may be able to be as productive or even more productive, not going into the workplace on a daily basis.
Thank you.
Should candidates take money from police unions? Your mom has done amazing work on police reform, but many of her Democratic colleagues continue to believe that continue to side with police on many of these basic questions about how they should treat civilians. What are your views?
Well, I have already stated that I would not take money from the police union. I cannot speak for what someone else should or should not do as far as, if they're going to take money. However, I do not believe that just because you are supported by an organization or a union that you have to agree with them at all times. No one should expect that. And people are going to, like I've said before, not always be on the same page about everything. You can always agree to disagree. I do not believe that just because you take something from a union or a person that you are beholden to them at all times. And so I personally am not taking money from the police union. I work with them on the city level, and I will continue to work with them. It's extremely important when you're dealing with issues that dip into their area of police reform, that they are brought to the table. However, I will not be taking money from them.
Let's talk about criminal justice reform for a little bit. That's a pretty good segue. Obviously something the other Dr. Weber was very involved in with her landmark police shooting and use of force bill. Some questions for you. What coming out of the last year of this racial justice reckoning in America, what policies or new approaches did you think would be good in the light of that? And has your position changed? Are those feelings that you had before Ahmaud Arbery and Breonna Taylor and George Floyd?
Mm-hmm. So I definitely believe that there needed to be police reform before those unfortunate situations occurred. But my feelings have just gotten stronger and more clearer in some of the areas that need to be reformed. All of us here are probably aware of the unfortunate incidents that happened in La Mesa this last year around the time of George Floyd's death. And that going through that process, making sure that there was finally some accountability, there was finally some movement in the area of police reform and transparency, really showed me how much more needed to be done on a state level. And so there were a lot of obstacles that we had to overcome. A lot of questions from our residents as to why is this taking so long? What is going on? And so that really showed me that there are a lot of things that we need to do. So first off, we need to make sure that there is a process of decertification. And I know that was a bill that Senator Bradford had and died on the floor. It has been reintroduced. But when you look at what I call rogue officers, they oftentimes have a pattern of this kind of behavior. And what has happened is they can just go from police department from police department from police department. And that behavior just continues. It doesn't necessarily get any better. And, I always say, as a surgeon, if I am sitting there and I am, if I'm having these negative outcomes of all of my patients, if my patients are dying on the operating table, I'm not going to be able to continue with my life. And I'm going to continue to be hired at other hospitals. And it also paints a negative picture of the medical community as a whole. And it's the same with these rogue officers. When you allow for one person to step outside and do what they should not be doing, and they're not necessarily held accountable, and they're allowed to just continue to move to other departments, it paints a negative picture of the whole department. So that is definitely one that needs to be fixed. The other thing is that we need to look to see who exactly we're hiring. And what does this training process look like? You are holding a gun, which is a deadly weapon. And, we need to make sure that we have very mature individuals in those positions. So raising the age limit, increasing the time of training so that it's more than just 6 months in the academy and then a few more months training when you get into the police, into the specific police department that you're in. And all of this leads to improved training, improved relationships. And then again, I also believe in community policing, because if you are very well aware of the community in which you live in, if you have relationships with the communities that you're in, then that also helps with what happens when you go on calls, because these are people that you know or that you're familiar with, and this is the community in which you live in. So if something happens like what happened in La Mesa, it's not that city over there, it's your city, it's your banks, it's your businesses. And so that's why for me, it's very important to make sure that we start really providing ways for our police officers, our fire officers, our public safety officers to actually live in the communities in which they work. And then finally, I do believe in oversight that allows for transparency, that allows for trust within the community. And that's why, I fought with the residents in La Mesa so hard to finally establish our Citizens Oversight Review Board, which we had been asking for 6+ years. But it's important when you're talking about police reform and just the overall relationships with the community.
Quick follow-up on that. When you say raising the age limit, what would you raise it to?
So, I think that we probably need to go and look in data to see what is best practices. Is it 24? Is it 22? Thinking of when people usually get a university, like you go to college and you're in university, usually somewhere between 22 to 24. There's a different level of development medically, or anatomically, I should say, and you're generally a little bit more mature to handle some of the situations that come to you, that you don't necessarily react or overreact at all times, especially when people are coming to you in a certain manner. You can take a breather and try to de-escalate the situation, escalate it even further.
That's interesting. Do you know, just as an aside, how many other states have done that, or jurisdictions? That's a relatively new concept for me.
Right. I don't think anyone else has, but California often leads the way in everything. So this is another thing we can lead the way in.
Yeah. And just real quick, two other issues that the other Dr. Weber has really focused on. Curious what your positions are, just quickly. Prop 16 and affirmative action. Did you support that measure? And also, I'll go ahead on that one.
No, go ahead.
Well, the other one was Dr. Weber's reparations task force. And so I guess the concept of reparations, is that something for African Americans specifically? Is that something that you support?
So, so I did support Prop 16. I was a local endorser. I was very open, honest, and outward for that campaign. Trying to get it passed is extremely important. And not only impacts our education system, it impacts our jobs, it impacts wages, and it, you know, California is a very diverse state, and we need to be able to see that diversity at all levels. You know, I tell people, you know, all the time when I walk into the operating room, usually, but even at UCSD, people know who I am because I'm like the only Black surgeon around, and that is, you know, unfortunate in a city that is as diverse as San Diego. And so Prop 16 would really start to change some of those things, really allow for those of us who are born and bred here to either come back or stay here and give back to this amazing state, and also to start to attract a more diverse group of people in every of society and of the workforce. And so yes, I was a proponent of Prop 16. I was unfortunate that it didn't pass, and you know, hopefully it's something that we will revisit again in the near future. Reparations, I also support reparations, that is repairing something that was damaged, and you know, the act of slavery and the consequences after that we're still feeling to this day. You talk about redlining, when you talk about when we're talking about inequities, those are things that were strategically done within the last, you know, 20, 30, 40, 50 years. And now we're saying, oh, we're so surprised that this area is very different than the other. Oh, we're so surprised that these individuals don't have the same health, the same education, the same resources as others. Well, those are things that were designed. And so, yes, we need to repair the damages that occurred that started at slavery and then continue to trickle down, because this was an issue that was never addressed in this country.
Thank you.
You mentioned earlier California leading the way on hot button issues, and I wanted to switch to climate change. You've got California cities, counties, and the state have fairly aggressive climate action plans. And I'm wondering what more should be done to limit the financial and environmental damage of climate change, and here in San Diego, particularly as it pertains to wildfires.
Yeah, great question. So La Mesa has a very progressive climate action plan as well. We were the first city in East County to adopt it. And we've also, you know, we're also part of the CCA, which we're very, very proud of. We are very committed to reducing our carbon footprint and providing, you know, equity when we're dealing with the issue of climate change. But one of the things that would definitely help from the state level is that if there was a push to create regional plans and also to fund them, because it is very challenging for a city alone to say, this is what we want to do for our residents, when the city itself may not have as many uses as others. And so when you're talking about equity and doing environmental justice, making sure that when we're talking about this, improving our climate, we're doing it for everyone, then, you know, we need to make sure that cities have the resources to do that, to make those impactful changes. And so it would be, you know, a great thing if we could do this as a regional approach as well, with funding for state, to make sure that those cities that aren't as, I won't say wealthy, but don't have stronger financial backing as some other ones do, are able to still implement some of the important things, greener spaces, you know, decreasing the amount of food deserts, you know, and all of those things. Wildfire mitigation is extremely important. And it's something that I think we need to do, provide more incentives to residents to do it, because I can, you know, do all that I can in my area or in my property to help with mitigation efforts. However, if my neighbor doesn't do it and a wildfire comes, then everything that I've done is kind of for naught. So, you know, we know, unfortunately, because of the climate crisis our summers are getting hotter. The chances of fires and hurricanes and floods and everything else throughout the country, unfortunately, is going up. And so we need to make sure that we are doing all that we can, including giving incentives for our residents to be able to mitigate certain things like wildfires.
Earlier, you talked a little bit about the pandemic, and I want to go back to that because the 79th is a very diverse district. Bonita is very different from National City, from Chula Vista, and the South Bay has been hit extremely hard with the COVID-19 pandemic. A lot of disparities there. What would you have done differently as you've seen the way things have rolled out?
Well, thank you so much for that question. And, I think that we've done a lot of things that were good. So I am on the county's health equity task force because we recognize that there is a disparity in who has access to certain things. But one of the things that have changed has definitely to do with testing. Testing, in my opinion, is key. And as a region, we needed to make sure that there was testing available and accessible to everyone. And for a long time here, what we saw was depending on where you were would determine what kind of test you got and also the timing of your results. So if I went to UCSD, my practice in La Jolla, and I got my test done, I could get my results in 24 hours. If you went and you got it at one of the county facilities, sometimes it would take 3 to 7 days to come back. And within that time frame, what you saw were people still interacting with other people and potentially spreading the virus. And so we needed to make sure that regardless of where you were, whether you were in South Bay or La Jolla or La Mesa or Southeast San Diego, that testing was accessible and readily available. There were still sites, not county sites, but other sites that were only testing based on symptoms. And we know that there are a good number of asymptomatic people with COVID. And so that should not have been a barrier. Once we recognized that, anyone who wanted it should have been able to get a test. And making sure that the testing, regardless of where you got, came back within 24 hours so that people understood where they were. Getting it 3-7 days later doesn't really help you. Doesn't even let you know where you are at that particular point because that was 3-7 days ago. And so that was one of the things that I would have definitely done differently, advocated for improved testing.
Could I just ask you for a quick follow-up on the vaccine rollout as well?
Mm-hmm. So the vaccine rollout, and throughout California, I'm very proud that we have vaccinated more residents than any other state per, our governor's state of the state address yesterday. And that too has been a challenge to make sure that it has been done equitably. I believe that, the fact that we have placed centers in different communities has been helpful. However, there were things that could have been done to help make sure that it was even more equitable in terms of more partnerships with local community groups to get the word out and to help making the appointments online. And once you get your vaccine, going ahead and making your follow-up appointment at that time instead of having you go back and make another appointment for your follow-up appointment. So there are things that we could have done and that we should do to make it the rollout more equitable and easy, because too often people were complaining about the fact that they'd go online and there were no appointments, or they couldn't figure it out, or they'd have to go back and put in all of their information. And for some people who aren't as motivated to get the vaccine, that alone is just a deterrent to say, screw it, I'm done. And so we needed to make sure that it was easy to get the first one, accessible, and then once you were there, you're a captive audience, let's just go ahead and make your follow-up appointment.
Just really quickly, there's been some discussion about the nature of the 3 different vaccines that are available now. Do you think there's any difference between them in terms of their efficacy, or if you can only get one or the other, does it matter?
Well, I think studies have shown that that there is a difference in the efficacy. Moderna and Pfizer are pretty much similar in their efficacy, around 95%. Johnson & Johnson has a decreased efficacy. And so I think it depends on what you're looking for and the probability of being able to have someone come back for a second vaccine, and also the storage. And so we want as many people to get vaccinated as possible. And so in certain situations, it may be more feasible to do the Johnson & Johnson vaccine. I was speaking with a physician the other day, a local physician who lives here in California, and he was saying, my goodness, it would be absolutely wonderful if, we had the ability to give the vaccine in the emergency rooms, because that way we could, we have a lot of different audiences that come through, like the homeless population, and you may not be able to get them to come back for a second vaccine. And so when they come in for care, say, hey, by the way, we have this vaccine, would you like to get it? And so in those situations, the ability to give something is better than not giving anything, or giving something that they won't be coming back to get a second dose. And then you also have to recognize the fact that the Moderna and the Pfizer vaccine are very challenging to store, and a very, very short lifespan once they're out. I remember when I got my first one at Rady's, they were looking like, okay, this batch is getting ready to expire. We've got to give this, to whoever happens to walk by. Where in Johnson & Johnson, you don't necessarily have that. You have a much longer shelf life. And so that allows you to take it out into some areas that may not have the capability of storage at those very, very low temperatures that you need for Moderna and Pfizer.
How would you evaluate Governor Gavin Newsom's performance? And who are the Democratic leaders that you look up to, both locally, in the state, and nationally?
So, this pandemic, we used to call it a novel, means it's new virus, because we didn't know what to expect. And, I was very proud of the fact that we got on this COVID-19 pandemic very early, that we jumped on it before any other states, that we recognized that we needed to shut down for a little while before any other states. And like I said, I'm very proud of the fact that, when we look at our vaccine rollout, that we have been able to vaccinate, more of our residents so far than any other state. I think it's always challenging when you or your residents are hearing mixed messages about the virus and the mitigation techniques such as masking. And that is something that, we dealt with for a while on the local level, local and state. We were saying one thing that was very different than what people were hearing on a federal level. And so, it was definitely a challenging time. If you don't mask, the virus continues to spread, and getting testing and funding from the federal government wasn't necessarily the easiest thing at all times. So I think, in the grand totality, here in California, we have done a good job, especially when we compare to other states. Are there things that we could have improved on? Yes. And I'm very hopeful that once we are through this pandemic, that we really take time to sit back and look to see the things that we did do correctly and the things that we need to change if it happens next time, recognizing the fact that viruses are here, they're not going anywhere. We are so interconnected in terms of the different states and countries that it's much easier for viruses to travel today than it was 100 years ago. And so, the chances of us encountering something like this again are high. And so we just need to make sure that we have a much better plan that we implement if this happens again, as far as testing and tracing and treatment, while we're working on the overall vaccine of whatever it will be in the future.
Sandag believes a large fixed rail network is crucial to addressing greenhouse gas emissions and to future of public transit. But public transit is not as popular as many people seem to think. Ridership is down in most places across America. So what do you think about the idea that Sandag has that the public will welcome fixed rail as an alternative to using cars?
Well, I think that over time, there are a couple of things like we talked about earlier. The pandemic, may change how we work, right? So as of right now, it is challenging to say that, we'll use alternative modes of transportation when where we work and where we live are so varied. I use myself as an example. I live in La Mesa. I have clinics in La Jolla, Hillcrest, Main Radies location, and Escondido. It would be very challenging for me to try to use anything other than my car, even though it is an electric vehicle, to get to all of these different places. However, in the future, as we're looking at maybe people not going into work as much, and we start building more where people are actually living, then I think that Sandag's view or their vision will be more likely to come to fruition at that point. But it is a challenge at this point based on where people live and where they work.
Obviously, after the pandemic, economic recovery is going to be, and currently is a big issue. At the state level, what would you do, and what do you think should be the priority when it comes to helping people recover? And then outside of a pandemic, what do you think the legislature is doing to improve economic outcomes in your district?
So thank you very much for that question, because that is an issue. Economic recovery is an issue that, you know, we, like every other city, you know, in the state have been dealing with. And we've done some things. We've worked with grants, taken some grants, some small business loan grants for our businesses to make sure that they are able to get back on their feet. I know that the governor in the budget has allocated a significant amount of funding for those grants and small business loans, and also waiving fees. We've done that in La Mesa as well, licensure fees. And I think it's important to note that those include things like barbershops and hair salons, oftentimes businesses that are not thought about and not a part of the initial, like the plan or the, you know, people who got the initial rollout of the money. But nevertheless, they are business owners, they employ people, they, you know, apply, they are part of the lifeline for individual cities in terms of making them unique, and also just, you know, part of the lifeline for the city's financial resources as well. And so it's going to be extremely critical to make sure that the funding that the state is giving now, that it's being watched to ensure that if we need to give more in the future, that we are doing that, working on a local level with local leaders. And that's why I'm very proud that I am a local leader, and I have relationships and endorsements from a significant number of local leaders within the 79th, because that is going to be key to making sure that that information is getting out to the residents and the businesses in the area, working with the local Chamber of Commerce, like, you know, our East County Chamber of Commerce, our Black Chamber of Commerce, San Diego Chamber of Commerce, to make sure that they are aware of this information and getting that information out to their members, but also that they are getting information back to me to say, hey, this is working, thank you so much, or no, this is not working, and this is what we need instead. And so that is going to be key to making sure that we are able to recover, and then also provide a cushion for if this happens again in the future.
I have a couple of follow-ups on the issues of housing and then back to schools. First on housing, I'm curious about your, sorry, I had an autoplay in my background here. I'm curious on housing, what your position on CEQA is, if you would welcome reforms or if you think it's fine as is, and also your position on subsidized housing. Tony Atkins and others in Sacramento are firm believers that that's an effective approach to getting more housing, but our board has taken the position over the years that it helps a relatively small amount of people for a high cost. And so I'm just interested in your position on CEQA and subsidized housing.
Thank you. So I do support CEQA. You know, I'm always open, and I tell people this all the time. My door is always open. It will always be open to sit down and listen. You know, if people feel like there needs to be reform, so I will listen, and there very well may need to be. However, I do support CEQA for a couple of reasons. I support making sure that that the environment is always taken into consideration whenever we're dealing with new housing development. But I am also one who believes in transparency and openness. And, the fact that that this is the process where residents, organizations are able to come and talk about a new project that is being proposed is extremely important to me. I do it on a local level, and I think that's a very important part of CEQA. Subsidized housing, it does. From my standpoint, I agree with subsidized housing. We have got to make sure that, again, our most vulnerable are able to provide, and that's whether we're talking about veterans, that's whether we're talking about people who are of our very, very low income, to make sure that they are able to be housed and decrease the amount of people who are homeless, either unsheltered or just kind of sleeping from couch to couch at their friend's house.
But
Go ahead, Chris.
Subsidized housing has been the approach embraced by the California Democratic Party for 30 years, and it has done nothing to solve the problem. So why stick with an approach that has not solved the problem?
Mm-hmm. And you know what? And I appreciate that stance. And like I said before, I am always open to other ideas and thought processes to see what really works, but what may work better. But until we have that, an idea or a plan, and there's data in front of me that says this is what has worked better in other places, then I would not scratch subsidized housing. And so I'll give you an example. Homelessness in La Mesa is something that we have not paid attention to traditionally. I said, we need to think outside the box. We cannot keep doing the same thing that we think we're doing and it's not working. Let's look at a program that does work. And that is, there's a program in Eugene, Oregon, Cahoots program that works. It's a different way of thinking. And so our interim chief of police went up there, took a look at it, came back and said, you know what, we can probably implement something like this in La Mesa. And we implemented it in November. It's called HOME, our Homeless Outreach Mobile Engagement Program. And so what that does is, instead of sending out an officer for these calls for our homeless population, as long as there's nothing violent, this newly hired social worker and mental health provider goes out and houses, goes out, does whatever needs to be done, gets them housed first, gets them their PPE. We have a whole vehicle for it, transportation. So it's thinking outside of the box based on something that has worked. And so I am definitely always open to someone saying, listen, let me tell you about this program in New Jersey that has worked, instead of subsidized housing or instead of whatever the particular issue is. And if it shows that it works, then we can tweak it to work here in California or within a certain community. I am definitely all for it, especially if it's something that we've been doing that hasn't worked for a while. But I don't want to scrap something unless we actually have something to replace it.
But in Arizona and Nevada and in many other states with less environmental rules, housing is much cheaper to build. And Governor Jerry Brown said in 2015 that we're never going to affordable housing our way out of this program with subsidized housing. He says we have to have more private construction. So I'm kind of surprised at the idea that this is something where there's not new ideas out there. There are new ideas out there that have worked in other states, but California has for years refused to listen to Governor Jerry Brown.
Well, I will tell you this. I am a scientist by heart, and I look at other things. And so if someone brings to me and says, hey, this is something that's working, here's the data, and not having a negative impact on the environment, and it is increasing the housing units, I would definitely, look into to see if that's something that we could do here in California. I'm not tied down to any idea or ideology.
Thanks.
And my last follow-up then was on standardized tests, which you kind of referred to in the LCFF discussion as saying you would look at gains on those to make sure that the state was on the right path and maybe could improve. Generally, you have thoughts on standardized tests as they are formulated? Do you support them? Do you think they need to be changed? Is there a value to them?
So, I believe that there is a wave throughout the country that is looking at the utility of standardized tests. I have friends whose kids are in the realm of going to college soon. And, they're telling me, oh, people aren't looking at SAT or ACT scores anymore. And that over time, those will be phased out. Those tests were, traditionally biased. And so I do believe that over time, hopefully we will find another way of measuring academic achievement than some of these standardized tests that probably all of us here have been subject to at some point.
And not the SAT and the ACT, I think I agree with you. How about standardized tests in public schools, though? In grade schools?
Again, right. So again, in standardized tests in general are oftentimes biased. And so we do need to figure out another way of determining whether or not a child or children are learning what he or she should be learning. And so those I too believe will be phased out over time.
Thank you. Anyone else have follow-up questions for Dr. Weber?
I just have a little bit of a personal question that I think a lot of voters might be thinking, wow, this incredibly successful doctor wants to switch her career over to politics. And I'm just wondering, what was the motivation? What was your personal motivation behind it? And will you leave your medical career completely behind?
Yes, that is the question that I get quite often. Like I've said, I recognize that there's only so much that can be done locally, and that we really need someone in Sacramento we need more people in Sacramento who look at things from a healthcare standpoint. There are not a lot of physicians who are active within the political arena. However, we oftentimes look at things from a different lens. We're used to collaboration. We're used to working with others. We're used to looking at data to determine what the best outcome should be. And like was alluded to, oftentimes what happens is people just continue to do the same thing over and over and over again, even if it's not working. And that's not something that we do in the realm of medicine. We can't, right? Because we're dealing with people, we're dealing with lives. And so we're constantly looking at evidence, doing what is evidence-based medicine. And so we need more of that within the realm of the political arena to really make impactful change. And the other thing is we've had a very strong advocate representing the 79th for the last 8 years. And we need to make sure that whoever steps into that role has a history of doing the same and has a record of showing that they have been able to get things done, not just talk about what should be done or talk about what they may have wanted to do, but actually show that because of me being in this position, this is what has happened. I can say that since I've been on La Mesa City Council, we now not only have a homeless task force, but we have a homeless action plan. I can say that since I've been on La Mesa City Council, we have finally addressing the issue of police reform by creating the Police Oversight Review Board and allowing it to have as much power as we can as a general law city. I can say that since I've been on La Mesa City Council, we are addressing and making sure that we are implementing our very progressive climate action plan and that we're improving our relationships with our community. And since I've been on MTS board, we're dealing with not criminalizing our most vulnerable as a member of the Public Safety Committee. So I can say that these are things that I have done. Within the healthcare realm, I've been, a strong vocal advocate for equity and making sure that our most vulnerable have access to quality, affordable healthcare. I established, Brady Children's as being a site where our adolescent and young adults can go and get confidential, free reproductive healthcare services, which is extremely important. So it's important that whoever gets into this role has a history of being that advocate, of being able to work across the aisles, being honest, and supported by many, and that is me. And so that, for all of those reasons, that's why I decided to run. The majority of my practice will close. I will probably still see the very, 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 very specialized patients and do the very, very specialized procedures. But the bulk of my practice would close.
Thank you.
Well, thanks for your time. And you kind of took the rug out of part of this last question with that pretty thorough answer there. But I like to close with asking folks to give us their 30-second elevator pitch to voters? Why should voters in the 79th pick you?
Well, thank you very much for that question. Sorry, I kind of answered it already, but I am a native of this district, born and raised in the 79th. I'm raising my children in the 79th. I am a local leader, and I've been in the community working. And you know, my goal is to make sure that we're creating healthy individuals, healthy families, healthy communities, and I will do that. I have a record of getting things done. I am supported by people on all sides of the aisle because they work with me, they know what I can do, and they know my heart. And I have a heart of service, and I'm doing this not for self-service, but to actually serve you. And it would be my honor to be able to represent you as your assembly member in the 79th Assembly District. Thank you.
Thank you very much, Dr. Weber. I appreciate it. Thanks for joining us today.
Thank you.
Bye. Thank you.